Preconception care, often referred to as PCC, involves medical and lifestyle interventions aimed at optimizing a woman's health before pregnancy. This is done to improve outcomes for both the mother and the baby. It involves identifying and managing risks, ensuring proper nutrition, and addressing any medical conditions that could affect pregnancy. Key components of preconception care include a thorough medical history review. This covers chronic conditions such as diabetes, hypertension, epilepsy, and thyroid disorders. Additionally, it examines genetic disorders like sickle cell disease, thalassemia, and cystic fibrosis. It's also important to consider previous pregnancy complications such as miscarriages, preterm birth, and preeclampsia. Lifestyle modifications play a crucial role too. These include maintaining a healthy diet, taking folic acid, iron, and calcium supplements, avoiding alcohol, smoking, and illicit drugs, maintaining a healthy weight, and of course reducing caffeine intake. Vaccinations are another key aspect of preconception care. Important vaccines include those for rubella, hepatitis B, varicella, flu, and Tdap, which covers tetanus, diphtheria, and pertussis. A medication review is also essential. This involves avoiding teratogenic drugs such as isotretinoin, warfarin, and certain anti-epileptics. Screening for infections is a critical part of preconception care. This includes testing for HIV, syphilis, hepatitis B and C, as well as sexually transmitted infections, or STIs. Preconception tests and their importance. A complete blood count, or CBC, checks for anemia and infections. This helps prevent maternal fatigue and reduces the risk of preterm birth. Blood group and Rh factor testing identifies Rh incompatibility, which can prevent hemolytic disease in the baby. Fasting blood sugar and HbA1c screenings are essential for detecting diabetes, which reduces the risk of birth defects and gestational diabetes. Thyroid function tests, including TSH and T4, detect hypothyroidism or hyperthyroidism, preventing miscarriage and developmental delays. A rubella IgG antibody test checks for immunity to rubella, which prevents congenital rubella syndrome and birth defects. Screening for hepatitis B and C detects viral infections, helping to prevent vertical transmission to the baby. HIV screening allows for early detection of HIV, enabling antiretroviral therapy to prevent mother-to-child transmission. STI screening for syphilis, chlamydia, and gonorrhea detects infections, preventing pregnancy complications and neonatal infections. A urinalysis checks for urinary tract infections and kidney disease, which helps prevent preterm labor and preeclampsia. Genetic carrier screening, if high risk, tests for cystic fibrosis, sickle cell thalassemia, and other conditions. It assesses the risk of inherited disorders. Pelvic ultrasound, if needed, evaluates uterine and ovarian health and can detect fibroids, polycystic ovary syndrome, or structural issues. Why is preconception care important? It reduces birth defects, such as neural tube defects with folic acid, lowers miscarriage and stillbirth risks, and manages chronic diseases like diabetes and hypertension before pregnancy. It also prevents infections that can harm the fetus, improves fertility in couples trying to conceive, and ensures mental and physical readiness for pregnancy. Who should get preconception care? All women of reproductive age, especially those planning pregnancy, couples with a history of infertility or genetic disorders, and women with chronic medical conditions. In conclusion, preconception care is a proactive approach to ensure a healthy pregnancy. Early testing and interventions can prevent complications, improving outcomes for both mother and baby. Thanks for watching, and don't forget to subscribe.